My name is Dr. Ashiq Masood. I am an associate professor at Indiana University School of Medicine. I'm also the program leader of GI Medical Oncology here at Indiana University Simon Comprehensive Cancer Center. We have seen over the last few decades the incidence of colorectal cancer in individuals aged less than 50 years old has increased. For example, since 1994, we have seen the incidence of colorectal cancer in individuals less than 50 years of age has increased about 50%. We don't know the real causes, why that is happening. Some of the hypotheses are maybe obesity, change in gut bacteria. Our dieting habits have changed over the last few decades. And many of these patients, those who are diagnosed of colorectal cancer, are in their 20s, 30s, and 40s, but majority of them are from the age 45 to 49. And this led to this significant change in the guidelines by the American Cancer Society. But I would also like to make a point that many of our patients in our clinic come in their 20s and 30s. That means that even though you may not be age 45, there are instances if you have symptoms, you may want to talk to a doctor. Any patient, even though they are in their 20s or 30s, or they're in 40s, if you have blood in your stools, or if you have abdominal pain or abdominal cramping, change in bowel habits, please talk to a doctor. It may be an early sign of colorectal cancer. Also, if on your routine blood test, if you have anemia, please talk to a doctor. It can also be a sign of colorectal cancer. Also, be open to talk to your family to know that if you have a family history of colorectal cancer, because that may change the time frame for your colorectal cancer screening. For example, if somebody in your family has a colorectal cancer at early age, that means you may need colonoscopy well before the age 45, as recommended by the American Cancer Society.